What's on my mind this morning, Daniel? There's been much talk, much conversation in recent days stemming from a question and answer session in the August 19 Office of the Prime Minister press briefing. The Prime Minister at that time responded to a question from a Jamaica Gleaner reporter. The Prime Minister's response, to my mind, was quite appropriate. The response from me was nothing complex, and I think if you only listened to what he said once, you could have still walked away with a full understanding of what he meant. Pretty much, for me, there was no ambiguity in his response. So the question was asked, and he responded, and the day after, no one said anything about it. 5 days passed, and it's safe to say folks had moved on from that question and answer session. There was nothing controversial that was uttered there. But on Wednesday, that understanding that nothing controversial was said was completely thrown out the window based on one error tweet, I believe. From all public communication, the controversy seems to have started from one tweet by the Jamaica Gleaner, and the tweet said the nurses were reportedly upset about the statement by the Prime Minister that they would not get preferential treatment in the event they became ill. There was word early Wednesday morning as well that several nurses across the island were on sick out. At the time, for me, I thought maybe they were on sick out because they're now overwhelmed by the COVID patient load and the working conditions. But not once did it cross my mind that nurses were on sick out because of the Prime Minister's response to a question about prioritizing healthcare and access to ventilators in the nation's hospitals. Because in the August 19 press briefing, the question and answer did not explicitly say nurses, and neither did it imply nurses. So I questioned how the nurses could have drawn from the Prime Minister's response that he was referring to them or rejecting them. Again, let's hear the clip of the question being asked by the Jamaica Gleaner's Corey Robinson and the response from the Prime Minister on the matter of prioritizing treatment.
My question is this. When the vaccine just came out, there was a list of priority persons, healthcare workers, the members of the security forces, etc. I'm just wondering, now that the hospital, we've reached at this stage with the hospitals at the capacity, will there be a list of priority persons for treatment and for ventilators?
I'm not going to pretend to be able to answer that question, so I'll ask the CMO, except to say that in these matters, once it comes to care, then only the standard medical triage would apply, but there wouldn't be any predetermined priority list. That would be problematic. The medical professional would have to look on a case-by-case and triage, but it couldn't be that there is a predetermined priority list. So I suspect I could say that the CMO would be satisfied with that answer, that we wouldn't give up a predetermined priority list for persons to get access to oxygen and so forth. No.
Firstly, the question didn't directly ask the Prime Minister whether nurses would be prioritized for treatment or ventilators. And secondly, to the core of the question about any sort of predetermined priority list for treatment and ventilators. I mean, to all reasonable and well-thinking Jamaicans, where would that be fair for the country's Prime Minister to sort of mandate that there must be a priority list in the hospitals for nurses or other frontline workers to be treated over another Jamaican citizen if they got ill? I mean, some sort of mandate like that would certainly bring the Holness administration in for some whipping. I can already see and hear the civil society groups and the ordinary Jamaican making a lot of noise about that move, and they certainly get my support. The only type of prioritization that should be happening in healthcare or healthcare system is the established triage system. The triage system determines who is more in need of care over another person at the time when you're in the medical facility. It determines who, as I said, is more in need of critical care, a seriously ill COVID patient, a gunshot victim, and the list goes on. I think it was Sir Cliff Daniel who said on Wednesday while speaking with our trooper colleague Ricardo, you can't possibly think it would be right to pull a ventilator from another person who needs it and give it to someone else because they're on a priority list. The thought of that is just morally wrong. For the nurses too, I'm sure their training and being on the front line would indicate that a move like that is completely wrong and is opposite what their practice or what they practice every single day when they step into the walls of their medical facilities. So the Prime Minister's response was misunderstood. It was thrown around and used to fit a particular narrative for me. We should do better in how we communicate every day and not use perfectly clear remarks on issues to fit somewhere that it doesn't fit. When we do these things, we only create more division and unnecessary controversy, manufactured sort of confrontations, and all the rest of the ugly bits that comes with issues like these. Now, the other aspect of this matter that was quite disappointing was the position declared by the opposition on the issue. Firstly, based on the press release sent on Wednesday by the PNP, it seems due diligence was not done, or maybe I'm wrong on that and it was always their intention to be that forward, I don't know. But the PNP statement picked up on the misinformation that was already out in the space about what the Prime Minister had said. They called on the Prime Minister to withdraw what they said was an offensive statement that he had made. The PNP statement that was jointly released by the opposition spokesman on health, Dr. Marie Sky, and spokesman on the public service, Lambert Brown, said, quote, the spokesman said special consideration for groups of workers in the public sector was quite usual, and that nurses were due special treatment because of their role in the pandemic and the extraordinary responsibilities they carry in the overburdened hospital system. It also said, quote, Dr. Guy and Senator Brown said they understood the nurses' plight, and as a result, the Prime Minister should not pour salt into the open wound and disrespect their service in any way. He should withdraw, instruct a meeting to discuss their condition of service, and provide urgent relief to their plight. On these 2 points, how was the Prime Minister pouring salt into the open wounds of nurses and disrespecting their service? A question was asked, and he responded that the government will not be sort of mandating prioritization ahead of time about who in the country fighting COVID will get a ventilator over another person. That is determined by the medical professionals when you're in the hospital. The spokesman said special consideration for groups of workers in the public sector was quite usual. It's quite usual for the government to mandate priority listing for some people like workers in the public sector. I've never heard of that one, and I could be wrong, but a move like that by the Jamaican government or by any Jamaican government would seem unprecedented. I mean, we know of the long-standing conversation about regular hospital treatment between the poor and the rich, but that's so different from a government now sort of mandating who gets a certain treatment over another person. I personally haven't heard as well of any nurses calling for a priority treatment list to be set up with their profession listed. I've also not heard from nurses that this was the reason for the sick out. As a matter of fact, several of the nurses spoke with our news center and they dismissed the statements, and they found the Prime Minister's comments offensive.
It would have to be on a triage basis, and I'm not sure where this came from, that we're actually upset about what he said. What he said was absolutely correct. There is no way that a nurse can come in with a sprained ankle who should be given priority over someone with breathing issues. It absolutely made no sense, and I'm not sure where it came from.
They have to have that eye-catching, that eye-grabbing headline so that it will grab readers. Mm-hmm. So for them to make such a, I would say, inflammatory statement like that, to say that we're upset, it actually trivializes the reason for this unrest. So as our Prime Minister rightly said, we would follow the appropriate triage protocol, and each patient would be seen based on that.
To begin with, at first, before I actually thought about it and so forth, at first I was saying, based on where I work and the fact that I'm on the front line, I was saying that at the end of the day, if I am a staff and I go to seek medical attention, of course I should be priority. But in eyes of the medical field and all of that, as it relates to triage, priority is priority. So if I, as a nurse, go there and have somebody with a more urgent matter, well, yes, of course, that person would need to be seen, which is why we are refuting the statement that we are aggravated by this.
So, moving away from these sort of spin doctor narratives and to the facts, nurses are indeed overwhelmed, Daniel, and they're indeed overworked and underpaid. These are the issues that we should be focusing on daily in the interest of our healthcare professionals who've been carrying most of the weight since last March in the nation's hospitals daily, trying to save lives. I mean, the revelation of $91,000 before tax, that is the problem. Nurses working with limited PPEs, that is the problem. Those are the issues we should be communicating and agitating on daily if we're really looking out for nurses and want better for them. Take those issues to the desk of the Prime Minister, the Minister of Health, and the Minister of Finance if we plan on achieving solid changes for those on the front line battling this virus. Let's score big points with solid changes by doing actual advocacy instead of scoring cheap points with no beneficial changes based on flawed narratives. That's what's on my mind.